how you can solve the problem of asthma if you're having any. So this my video will take you deep down on what my recommendations and prescriptions will be like. Alright. So now let's start. Asthma, as we know, is a restriction of airflows into. Sometimes you might have airflows into your lungs, alright. But if you can't utilize this air, there is two ways. Either there is obstruction of airflows into the lungs, or there is inability due to alveoli diseases, which might affect your alveoli, which is making the air not being absorbed as required or pass through the alveoli, all right, to your blood vessels. So these are the two basic cases. And another cases is that you're having the good airflows into your lungs, but one thing is there, one problem. The problem is that the time, because we have something called the tidal volume, all right, which is 500 ml of air coming in and it goes out, all right. So if we inspire in, all right, now if the air goes out, all right, now if you're not having a good capacity to adapt in aspect of taking this air in, then your asthma will be there. You will not be able to please your muscle at a particular seconds, because most times the air we breathe in a seconds, like 1 second, I guess, if I'm not mistaken. So how can you solve these asthma issues? That is where I come in play. Asthma issues, I'll tell you from my own point of view as a sports therapy, what I would suggest to any patient is exercise. First of all, you can get inhaler before we start our exercise, all right? Because the inhaler have to be with you so that in case there's any issues or any needs for this inhaler, you can use it and relieve yourself, right? Now coming to the exercise part, there are just two exercises I will give you and I will tell you why. The first exercise is aerobic exercise, and this exercise, why I'm giving you aerobic exercise is because if you're working on your lungs, all right, you're working on your lungs. For example, most people they have small lungs volumes. Lungs volumes is about 6,000 6 liters, if I'm sorry if I'm mistaken, 6 liters of lungs volumes, all right, total lungs volumes, all right. So somebody who is an athlete who is working on inspiration, like running, jogging, aerobic, those are kind of aerobic exercise. So if they are used to it, that means their lungs volumes, as times goes on, it increases, all right. But if you are not working on your lungs volumes and your lungs volumes is very less, then you know that you have chances of not being able to take much air, like your tidal volume, it might decrease. Instead of normal average of individual 500 ml, it might decrease furthermore. So if the air coming in to your lungs is not huge, your body, even if it's passing through, your body will not be so contented with what they are getting. You still feel breathlessness, all right. So as aerobic exercise come in play there, and aerobic exercise gives you more adaptation. Instead of, apart from you having the air coming into your lungs, it gives you more adaptation, whereby in aspects where you have issues, obstruction or anything in your lungs, or in aspects where your heart is not compensating, aerobic exercise increases the heart capability and adaptation of the lungs and the heart. This aerobic exercises is very important for these two crucial components: expanding the lungs, making the lungs more stronger, and adaptation. And in case of these chances, because if you're going to aerobic exercises, as if you're pushing yourself into the pain. Now you get used to the pain, then if the causes or the issues arise to you, you'll be able to handle it. You understand? I don't know if I'm making sense. I'm just trying to explain. Now, the aerobic exercise, I've told you, see, as a asthma patient, there's just one thing you have to do for aerobic exercise, and that is to buy treadmill. Don't go outside to jog. Don't go outside, because if you go outside, there is more chances of dust, which aggravates asthma. So if you do it outside, it will affect you the more. So what you have to do is just to buy your treadmill. You can stay indoor in your house, and you can do these exercises. Right. So indoor in your house, buy a treadmill if you have, or if you have a treadmill in gym, avoid going outside so that you will not aggravate your symptoms. Number two exercise is resistant exercise. Now, in the resistant exercise, same like the aerobic exercise is very good in adaptation. Resistant exercise will help you in adaptation, especially cardiac in aspect of capillarization. What I mean by capillarization is because the blood supply, for example, my hand is very strong. You can see here, you can see this groove here, right? You can see the groove here, you can see another groove here, and if you see if I remove my shirt to, you see like most of these athletes who lifts heavy weights, they have big huge muscles, especially muscles of the shoulder. It's more huge compared to the normal sedentary individual. So if you are not going to gym, you're not doing any resistant exercise like lifting heavy weights, your body will just, your muscles will not feel the need to initiate the contact asking for more blood supply to different parts, because your blood supply will be able to do their normal daily job. But if you're going to the gym and every day you're doing your resistant exercise and your body expand and gets into another adaptation of the athlete's kind of body, right? Now your body will be calling for blood to those parts where the blood vessels is not reaching, and there is something we call capillarization, all right, where the capillaries will be creating more branches. All right, I don't know if you understand me. So your adaptation will be there and your improvement will be there. Now the exercise should be done every time in a week, 7 days in a week or 6 days in a week, depending on what you want to do. You can do it twice in a day or once in a day, but I think consistency is more key to your goal, to achieve your goal, right? You should do it on a consistent basis. So that is it basically. All right, and you can start by small. Don't just go high and start running. Do whatever you can do and gradually you increase it. All right, so for the resistant exercise, you should lift heavy weights, dumbbell, chest press. If you go to the gym, you'll see the weights, you can try them out, and this capillarization will help you and increase your blood supply to different part of your body. So these two exercises are very crucial,